We are a tribe, and we are a family, and we are all taught to take care of one another. Every one of us can make a difference during these types of crisis situations, but not one of us can do it alone. The Winnebago Tribal Council and the Winnebago Pandemic Task Force and various subcommittees are continuing to meet and develop ways to address issues during this time relating to things such as food security, housing, business and employment, communications, healthcare, education, and funding to support all of these efforts. Most recently, the tribe shared information about the funding that's been available due to the COVID-19 in order to help us address all of the issues and be prepared and to respond. And additional updates and details will be shared with the community as those decisions are finalized. I would like to encourage each and every one of you to continue to practice social distancing, spend time with your children, and take care of your elders so that they can all stay out of harm's way. At this time, I'll turn it over to Mona ZUFFANTE, who will start with our presentation for this week, and we have some announcements to make as well. Thank you.
Thank you, Chairman Brown and DANELLE, for all the good words. I also want to express my thoughts and condolences to all of our mourners at this time. Some events that are going to be taking place. We will be having Test Nebraska set up here Tuesday from 10 to 2 at the Winnebago Public Schools bus barn. Angie will be talking about it a little bit more. I do strongly encourage everyone to sign up if you wish to be tested. This will keep the lines down and get you through the process faster. We do have a flyer that will be posted on our Facebook, so please share that and go like us as well. If there are any issues that arise, I will try to be on site for most of the event so we can mitigate those as fast as we can. But if you are symptomatic, please, you can still test through the 12 Clans Unity Hospital, and we can arrange it through either calling the hotline or calling your primary care provider directly at the hospital. I also wanted to let the community know that after this mass testing on Tuesday that we might see another influx of positives. So we will address those as we need to, if we need to, and let the community know as we get those test results in. Last Friday, we were able to make quarantine housing available at the cabins. Sorry. If needed, at this current time, we are available for one positive person per cabin. So how does this work? The PHN makes contact with that positive person, does an interview. If they do not have anywhere to isolate or their present situation doesn't allow them to isolate within the residence, then they present that to me and we work to do our best to mitigate that situation. The cabins are only available during the quarantine phase. So once the quarantine is lifted, the positive person will be released and find alternate housing or will return depending on their case, of course. We are working on getting a caretaker for this housing so they can assist with coordination of the needs of those individuals. But at this time, the coordination of services are between myself, PHNs, CHRs, and Wildlife and Parks to meet the needs for those in this particular quarantine housing. I also want to remind everyone that the hotline is not an emergency line. It is an opportunity for the community to get information and to be able to be triaged in order to get testing if warranted. And also for isolation and quarantine people to get assistance. The hotline is only able to get over the counter and other supplies, and they also try to coordinate with the outpatient clinic. And they are able to prescribe medications for those quarantine or isolation patients depending on their situation. But at this time, if a positive person feels that their symptoms are worsening, then please call the ER prior so they know that you're coming in, but you can go to the ER to get assistance. So I want to make sure that that's very clear to our community. I also wanted to touch on some of the procedures that have been brought to light, especially within the last few weeks. So if our loved one dies at home, I want everyone to know kind of what happens. So EMS will be called. They will follow the necessary precautions outlined by the wake and burial program. There will be no COVID test performed on scene. But if the family wishes to have an autopsy performed, that will be up to each family to decide on whether that's their wishes. COVID is not transmitted by our deceased. It can only be transmitted by the droplets that they exhale. So I just wanted to mention that. On a brighter note, the Kids Cafe started this week and we have tripled in meals. They are averaging about 350 to 380 meals daily. Last year, just to give comparison, we served about 150 daily meals. So this is a significant increase for our staff. They're trying to put together nutrition and physical activity packets for every meal that goes out for our children. The Senior Citizen Center will be closed next week for some repairs. But if you have used all your freezer meals or the other supplies that has been given to you, please call the CHR program and we will make alternative arrangements for you. Also, the CHR program was able to deliver about 27 supplies to the quarantine families. Also delivered the produce baskets from HCCDC this morning. We appreciate the food sovereignty subgroup for also preparing some baskets for our quarantine families, and as well as Atlas program for working with our medical services to also prepare additional supplies for them. I know a lot of people are asking about Pet Care Day, so we will be scheduling it for July. It will be at a different location. We're looking at Land and Wellness so that we can properly distance as well as have a bigger outdoor event so that people can get their animals vaccinated. So those flyers should be coming out within the next few weeks. I also want to encourage everyone to remember to use your precautions if you're going out to eat in the restaurants that have newly opened, or if you're going to the Sioux City fields, just please remember to use all the precautions that you need to keep yourself safe. I also want to continue to thank everyone for everything that they're doing for our community, working together, working towards a common goal. And thank you again for all the staff that are working through this stressful time and all those work that behind the scenes. We all continue to be at risk for COVID-19 infections, so please continue to stay home, stay healthy, and stay connected. And so now I will turn it over to Angie Keller, our Public Health Nursing Director, that will start this week's presentation.
Good afternoon, everyone. I want to thank you for taking time to watch our live presentation with updates regarding COVID and the preparedness and response that Winnebago WCHS has done within the recent weeks. So we'll go ahead and get started. The current statistics for COVID cases for United States, Nebraska, and Winnebago are within the United States. There's a total of 19,811,243 that have been tested. Of those, 17,969,142 have been negative. There's been a total of 1,842 positives, or 1,842,101 positives, with a total death coming to 107,029. For the state of Nebraska, there has been 112,409 tests completed. There's been 97,389 negatives. There's been 14,866 positives, 187 deaths. For the Winnebago community, so those are individuals that live in Winnebago, there's been a total of 163 tested, 113 negatives. There's been 47 positives with 16 of those recovered. There has been 1 death, and then there's currently 3 tests pending. For non-Winnebago residents, so anybody that's come to WCHS to get testing that lives outside Winnebago, there's been a total of 155 tests completed, 110 negatives. There's been 42 positives, and then 3 tests are pending. As Mona had mentioned, there is going to be a mass testing event happening here in Winnebago. And that's going to be Tuesday the 9th from 10 to 2. That's going to be, the location is going to be the Winnebago Public School Bus Barn, and the address is there, 107 West Osborne Street. And then when you get there, there will be cones and directional markings and stuff for you to go to follow, so then you know how to get in and out of it properly and to have the least amount of congestion as possible. Any Winnebago community member that is either symptomatic or asymptomatic can be tested. So that's anybody that wishes to get tested can be tested. We are asking to make it a little bit easier and go a little bit quicker, that you do register before the day of the test. The website there is the www.testnebraska.com/en. And that's just to make it go a little bit smoother. If for some reason you don't have access to the internet or to the website to register prior to the testing event, you can always register there. They will have people there to help you register. You can drive up or walk up. So if you don't have access to a car, you can always walk over there and they will do testing with that. Testing will be only for individuals if they currently have the coronavirus. So that's what the testing is going to do. It's not going to do anything else. If you've been infected previously, it's only going to see you're only going to result with an active infection, or it's going to be negative, so you won't have an active infection. With that, we are trying to get as many people tested as what we can. And as Mona had mentioned, that there may be an increase in positives during this time because we are trying to do a mass testing event. So please keep that in mind. And then I wanted to go over a couple things for the community, as well as what to do after you get tested at mass testing or with WCHS if you're symptomatic. So the one thing that you have to do is continue social distancing measures no matter what. That's if you're asymptomatic. So if you're not having any symptoms and you're going to get tested at the mass testing event, you still need to practice those social distancing measures. If symptoms are present during the mass testing event, if you have symptoms and you're going to get tested either there or at the hospital, you do need to socially isolate yourself from other household members to a room within the house, or and especially with the public. And that's just to kind of act as if you're positive until we get that negative result, or until it is confirmed it's positive. That will hopefully decrease any exposures that you would have to anybody in the community. If you are negative, so if your result comes back negative, what would happen next is you would just practice the social distancing measures. So that's the 6 feet distance, wearing a mask out in public, and then the high surface or the high touch areas. You want to make sure you're cleaning those properly and efficiently and constantly as well. And then if you are positive, if it is found that you are positive, what would happen next is you would need to socially isolate yourself from your household members, as Mona had mentioned. If you're not able to do that within your household, then we do have some space available for 1 positive per cabin out there with the wildlife and parks area. But if you are able to isolate within your home, then you want to isolate yourself to 1 room. Follow the isolation measures that the PHNs will definitely go over with you. They'll give you a call to do some contact tracing. With that, it's to see who you've been in contact with days leading up to your positive test, or up to the symptoms being present. So the best thing to do is, if you do have a positive, is just to either write down or take a mental note of close contacts that you've had 3 days prior to your testing being completed. That'll kind of help the close contact investigation go a little bit quicker, and kind of help bring up any individuals that you could have missed, just because there's so much information coming in at one time. Just taking a second to kind of go through and do that on your own would help too. When you are contacted by the PHN or a contact tracer, they will go over your contacts, and then we'll notify all those contacts to quarantine. And with quarantine, what that means is those individuals will need to stay within their home or within kind of their yard. Since it has been nice outside, they are able to go outside within their yard, but they can't have any contact with any neighbors or anybody out in the public. It's only within their household. Laura's not able to be here today, so I'm going to go over the remainder of the slides. So with WIT 12 plans, Unity Hospital and the updates there, she wanted to take a chance to go over the testing and what would happen after the mass testing event that's happening in, at the bus barn there at the public school. If you think you need to be tested with symptoms, or if you have questions about being in close contact, we do ask that you call the hotline. And then that number is 402-922-1508. COVID testing is not an emergency. The positive test result or the negative test result will not necessarily change the care or the services that you would get. It just would give an individual a response if they are positive, and then would allow the public health nurse to do the contact tracing to get those other individuals that have been in close contact quarantined or isolated to help prevent any future exposures. But the self-care measures would be the same as if you're positive or negative. If you're experiencing emergency and need immediate care, then we do want you to go to the emergency department. You just have to make sure that you are calling beforehand, so you can alert the personnel or the healthcare providers there that you are coming in, so then they can have everything ready for you and they can be properly protected in their PPE. You need to let the screeners know that you want to be seen in the emergency department and you are seeking care when you come in. They will do a screening and ask you questions and grab a temperature. Hopefully you'll already have a mask on, but you'll be asked to wear a mask if you don't already have one on. And then if you're not experiencing an emergency, but you need medical care, you can call your outpatient or the OPD clinic or your provider and set an appointment up with them. They are doing telehealth services now, so they can schedule you to come in and be seen, or they can actually do the appointment virtually too, to help, so you wouldn't have to leave the house. Anyone that goes into the hospital for the purpose of being tested, so if you're going to the ER and you don't have any symptoms, but you just want to be tested, you will be asked to call the hotline or your primary care provider. And then that time, the information will be obtained to see if you meet testing criteria and if the testing is needed. Those living in the same household or who have had close contact with someone who's COVID positive will be checked in on a daily basis by the PHNs or by those that are doing the contact tracing. We'll check on symptoms and everything like that. And if any time testing is warranted or needed, then testing will be set up at that time. Unfortunately, outside of the mass testing event, we are not testing asymptomatic people, but during the mass testing event, anybody can go and be tested. 12 Clans Unity Hospital will continue to test symptomatic patients after the mass testing event is completed, so that the process we have right now will not change. Anybody that comes in that needs testing or is requesting testing and has symptoms and meets that criteria, the testing will be completed at that time. And then with employees that have had exposure or been identified as a close contact, Laura went over this last week to kind of give the outline of what happens. A lot of it is with what would happen within the community. It's a little bit more detail oriented just because with healthcare workers, they do have exposure sometimes to patients, to other staff, you know, where they're going about the hospital. So this kind of breaks it all down. It's evaluated just like everybody else if they're having symptoms, if they're asymptomatic or not. They do report to the employee health nurse, which oversees their time off, if time off is needed because they have to quarantine, and checks their symptoms. It's a team has been put together to figure out if they need testing, how long they're going to be off, if other people need to be quarantined as well because they've had exposures, if they had proper PPE on during the exposure or it was outside the clinic where it happened, if they've had symptoms, and if they did, when did they start. And then if it is decided that an exposure date or there was an active COVID exposure, then testing, if testing is warranted. There's been changes to the risks of exposure. So that's the high and the low risk. And that's kind of what we've gone over with the contact tracing and stuff in that little circle there. The individuals within the blue circle are considered high risk. Those between the blue and the black circle, they're low risk. So they would not need to self-quarantine, just social distance. And then the rest of it, the last part of it is just when they're actually returning back to work. So there's guidelines for individuals that they have to meet in order to return back to work to make sure it is safe for them to be working with patients and with other healthcare staff. On behalf of the entire WCHS team, we want to thank you for your time watching this and keeping us and letting us update you with the changes and effects that have gone in effect here with the public health and with the WCHS or the hospital side. And then just asking any questions that you have regarding it. I know it's a lot of information, so works really well for you to ask questions, so we can answer all those that we possibly can. And if you do have questions, the question and answer session will take place shortly, but please submit any of the questions that you have to the live stream chat feature or via COVID@winnebagotribe.com.
Thank you, Angie. At this time, we're going to go into our tribal entities update, starting with our Winnebago Tribe CEO, Esther Mercer. Esther?
Hold on. Hi, can you hear me?
Yep, we can hear you, Esther.
Okay, sorry, I was muted. Okay, I would like to thank everybody for joining us today. And I would also like to offer my condolences to the families that are in mourning. Our thoughts and prayers are with you at this time. We just have a few brief updates from the tribal departments this week. From the Wake and Burial program, there should be some revised protocol being distributed to the community, and that's going to be going out on the tribe's Facebook page, so please keep an eye out for that information. From our tribal human service office, the human service department will be conducting a summer youth education program this summer. The program is open to youth ages 14 to 19 who live in Thurston, Dakota, or Woodbury counties. To be eligible to participate in this program, you must meet the eligibility requirements, including that the participant has to be under the 150% poverty guideline threshold, and they must be an enrolled member of any tribe. So it's not limited to just Winnebago tribal members, as long as they're enrolled in any tribe. The goal of the program is to provide education and employment to the tribe's youth, and the program will be ran entirely online. There are currently 7 slots open. The program will begin this Monday on June 8th and will run until August 14th. If you are interested or you know of any youth that would be interested in participating, for applications, please call 402-257-5586, or you can email the Human Service Department at wtnhumanservices@winnebagotribe.com. The Human Service Building currently, our current office hours are Monday, Wednesday, and Friday between 12 p.m. and 2 p.m. if you would like to reach out to speak to somebody directly at the office. That concludes the updates this week for the tribe. Please continue to access the website and the Facebook for announcements and departmental updates. I'd like to thank you for your kind attention and have a nice weekend.
Thank you, Esther. At this time, we're going to turn our attention to Dan FEHRINGER, the Winnebago Public School Superintendent. Dan.
Good afternoon, everyone. First of all, I'd like to express my condolences for those families who are grieving. As far as the update from the school, the weightlifting and conditioning will start Monday. Coach Barrage and Coach Bear will be in charge of this. Each student will be required to have a signed waiver before he or she can participate. I know they've reached out to the student athletes and have delivered the waivers. So I've talked to a couple parents already. The girls will be going in the morning session and the boys in the afternoon, and they have to stick to their groups. We are continuing to work on plans of small groups for academic support coming this summer. We will be meeting again Monday to put those groups together. We'll be contacting the parents once we get that done, and we'll probably start around the week of June 22nd or the week following that. It will be, we're not exactly sure how many days a week, how many hours a day, but we want to get as many kids in that need that academic support as we can throughout the rest of the summer. The playground and track construction is near completion, and that will that really is beautifies the school district and the district up here. So, and as far as the other construction part, we are starting to move classrooms around And that's kind of why we're on hold again for the summer school, is we're going to have isolated rooms for these students as summer school approaches. And again, continue to practice safety measures and social distance, and hopefully, and we will get through this by sticking together. Thank you.
Thank you, Mr. Fehringer. At this time, we're going to go over to Little Priest Tribal College President Manoj. The floor is yours.
Good afternoon. Yeah, thank you, Garen. Good afternoon, everybody. Before I go through my notes, I just want to again extend our heartfelt condolences to the families who are grieving. I also want to take this opportunity to all the people who have gone through discrimination and racial discrimination, and all the protests that have happened due to Mr. George Floyd's death. I hope the country can heal, and the AHEC, in American Indian Higher Education Consortium, is putting out a statement to the public very soon. With that being said, I would like to get started with some of the major updates from the college. Summer 2020, we have our final census data. We had 95 students with a 150% increase from last year in terms of enrollment. I'm thrilled to share this information. Some good news during this time is great news. We as a community have struggled, but are held together by all this support. So I'm grateful for the community members who have stepped us to support us. So thank you. We are making plans for a graduation, and we'll be sending out the information very soon. We are also planning for fall 2020 semester. I'm happy to share that the Higher Learning Commission has approved our online instruction for fall as well. That gives us options to offer face-to-face or online instruction. With the rate of infection at the Winnebago tribe a little higher, we are requesting the Board of Trustees, who will meet next week, to see if they can if we can do fall 2020 completely online, just like summer 2020. It is pending board's approval. Just like summer 2020, we will be offering incentives and grants to make education affordable for everybody. Please look out for some exciting news and options from Little Priest Tribal College on our website, on Facebook pages, I would say in 2 to 3 weeks. Take this opportunity to continue your education, and I always believe everyone should be a lifelong learner. I'm happy to report that the historical trauma part 1, taught by our own faculty member, Cassie Kachan, had a record enrollment in her class in summer 2020. So you can take a course, you can audit a course, you can take it as a learning just for fun, but great opportunity for you guys to continue your education. We are also planning for college reopening. As of right now, we have a tentative date of July 6th of college reopening for employees only. We have created a rotational matrix that will tell how many employees will be there on the campus and what times. We are putting some to help temperature screening booths and other precautions as we open the college. With that, I thank the Tribal Council, the Pandemic Task Force, the subcommittees for all their efforts, and I hope everybody will have a safe and a good weekend. Thank you.
Thank you, President. Now we are going to go over to Sam Burrish, the Communications Officer for Communications Manager for HOCHUNK Inc. Sam.
Thank you, Garen, and good afternoon. I have a brief update today, but first we'd like to express our condolences to the families in mourning. For the business, Sweetwater Cafe in Winnebago has changed its hours from 7:30 a.m. to 2 p.m. and the Sioux City location remains closed. Hours for all our convenience stores and coffee shops can be found on their respective Facebook pages and are posted at those locations. In the Ho-Chunk Village, we are looking forward to the upcoming farmers market season. The farmers market will start on Wednesday, June 17th, including a number of safety guidelines. If you'd like to learn more, please visit the Ho-Chunk Village Farmers Market page. And with that, I will turn things over to Brian Mathers with HCCDC. Go ahead, Brian.
Thanks, Sam. Yeah, Sam mentioned the farmers market that's starting on the 17th, so I will just add to that, we are still accepting vendor applications. So sign up if you're at all interested in being a vendor, any of folks out there, and we can get you set up and ready to go when that opens on the 17th. I'm happy to let people know that we are able to offer a third month of rent relief to the low-income tax credit renters and elderly tenants in the Ho-Chunk Village. It's 60 households total. So this will be May, June, and July that they won't be responsible for rent. And we know that people really need that help right now because they have other types of costs and have had interruptions in their income. So I'm really happy that because of the generosity of some foundations that have donated for that, we're able to offer that third month of rent relief for those folks. This morning, we also had our farm to family food distribution out of the farmers market in Ho-Chunk Village. Got 160 boxes today. The first week we did this 2 weeks ago, we had 80 boxes. Then we doubled that 80 to 160 last week. And actually this week we had 240. So we tripled it from the original amount. And 25 of those are going to the public health nurses and the community health representatives for people that wouldn't be able to access it otherwise or that have particular need. It looks like this is going to be able to continue through the end of the summer. Our distributor needs to find out for sure how many more weeks they'll be going, but their best guess was that they'd at least be able to go through the end of August. So this is really great, high quality, fresh fruits and vegetables eligible to anybody that needs it. So watch for that every Friday going forward through the end of the summer. Next week, we've been taking applications for short-term low-interest loans for people that need that. We have some applications in there. Those will be processed and approved next week. And so those will be out to people. And I think that's about it for me. But lots going on. And again, I appreciate what the community is doing and how people have kind of ramped up to do this. Health professionals have really stepped up to the plate. Our educational programs are making preparations and getting record enrollment and all that stuff. So despite how many challenges we have and all of the difficulties that families are facing, the community is hanging together and we're making the best of the situation. So stay safe, everyone.
Thank you, Brian. At this time, we're going to go and turn our attention to John SNOWBALL, the Winnebago Pandemic Task Force Chairman.
Thank you, Garen. And want to start off with acknowledging our family that has had a loss of their loved one, their family. It's our loss, we're people. And always do that every time, try to acknowledge that and pay that respect and know that we're thinking about them and we understand what's going on. And that we mourn with them, we're going to stand with them and encourage them the way we always do. And want to thank everyone, for updating us this week. It's real valuable for our people, and it's a real special thing that we do. And thinking about what's going on in this country with the riots and the looting, and it's been on my mind, and how this is going on during this pandemic, and thinking about the officer and what happened. I think about my own law enforcement training. We went through scenarios after we was completed, and one of the scenarios was I pulled up on a scene and there was an officer there, and he had somebody in cuffs, and he was being unnecessary, using unnecessary force, and I stopped him, and that's what was put for us to pass that scenario, to become a law enforcement officer. You know, a real special thing that I'm proud of. And so it was hard to see that. But it also points out something. You know, it shows us how we still need to grow as a country. You know, that even us as Native people, people that are from here, we went through hardships, and our parents and our parents' parents, you know, they lived in a different time, a different world, and they made sacrifices and they fought. You know, they didn't give up, and today we live in a better world, and we need to continue to do that, continue with that, and that's how things will get better. And so I wanted to say something towards that, and a little update on the pandemic and the task force and the CARES Act. I know people have a lot of questions, and we've done a lot of work. These funds that have been forwarded to the tribe they're restricted. You know, that they have a lot of strings to them, and we need to be careful, and we need to be smart on how we utilize those. And even this morning, I was on a call with the Buffalo Council, and our legal counsel was there, and she expressed that a lot of tribes are having trouble. You know, they're having trouble spending these, and they might be looking at giving it back. You know, if you can't spend it, if you can't utilize it, then you might have to give it back. And so I'm real proud of the way Winnebago and our team and all our best people have put together this budget. You know, we have a budget that's gonna use these funds in response to this pandemic. And so I just wanted to reassure everyone that we're moving forward, and that, you know, don't ease up. You know, this isn't time to ease up. Our numbers on the rise. You know, we live in a part of the country that is still on the rise, and I just wanted to reassure everybody and re-encourage and take care of each other. You know, when we can do whatever we want to do, but when it comes down to it, it comes down to each member, you know, each father, each mother, each son, each daughter, to take care of each other, and to be mindful, you know, that we need to stay healthy, and the only way that we can do that is by taking care of each other. You know, that's the most powerful thing that has carried us this far, is going to continue to carry us a long way. Thank you, Garen.
Thank you, John. At this time, we're going to turn it over to Emily from the Winnebago Comprehensive Healthcare System, the communications manager for the question and answer session for the health officials. Emily.
Thank you, Garen. Thank you to everybody who submitted questions for the last 2 weeks for our Q&A sessions at the end of these live streams. I want to remind everybody that you could submit your questions in the chat feature on Facebook or on YouTube, where we stream this. And also you can email any questions you have at covid@winnebagotribe.com. And we will do our best every week to be as transparent and informative as possible. So again, thank you to everybody who submitted questions for this week. I will go ahead and kick it off with the very first question. The question is, I think the health department should release the quarantine names. Why is this not possible? Where exactly in HIPAA does it state that a sovereign nation can't protect our own members? Didn't the Winnebago tribe declare a state of emergency? That should supersede everything. We need to know for our protection. So I'm going to turn that question to Danelle and Mona, if they can answer that.
Thank you, Emily. First of all, I guess I will say that I understand the community's concern about who has tested positive for coronavirus and wanting to know that information. However, the HIPAA laws, which is basically a patient privacy law, is a federal law, and we are subject to following that law. And so what we can do is assure the community that our public health department is taking all of the actions necessary in order to identify who those individuals are when they test positive, to interview them, do the appropriate contact tracing, follow up with those individuals who are determined to be close contacts, and they are provided with the instructions on how to quarantine and what steps that they should be taking. Aside from that, all of us as individuals really should be focusing on taking care of ourselves and taking all of the precautions and the recommendations that have been made to wear your masks in public, maintain that social distancing, stay 6 feet away, limit your activities out in public areas so that you can limit the potential for exposure to you and your family. And so it's those actions that are most important, and that is what is going to protect each and every one of us. And essentially, as this pandemic is among us and continues to spread in our community, it's important for us to take those precautions and to basically treat and act as if everyone around you could potentially have COVID, because nobody intentionally spreads it to somebody else. Before a person even exhibits symptoms, they may have it without knowing it, and they may be contagious. And so that's why it's so important for people to just continue practicing that social distancing.
Thank you, Danelle. Next question. Do tribal members that live off the reservation get any health benefits, prevention services, or even food? If we get infected with coronavirus and want to come to Winnebago to be monitored, is that possible? And could you house us? I'm out of work and looking for my tribe to help, especially now during a crisis. Danelle, can you answer that one?
Sure. So healthcare services in Winnebago at 12 Clans Unity Hospital are open to any tribal member, whether you live on the reservation or not. And so you're eligible to receive direct care services through our facility. We do also have the purchase and referred care program. And so if you live within the purchase and referred care service delivery area, then there are additional healthcare benefits that can be accessed through that program. And that our area covers the Winnebago Reservation, Dakota County, Woodbury County, and Dixon County. And so that is basically the scope of the healthcare services that we have available. Let's see, that was a multi-part question. If somebody is infected with COVID-19, the recommendation, unless you are serious enough where you require hospitalization, the recommendation is for people to remain home and to practice all of the self-care measures that are recommended by the CDC and by our local public health department. And so that would be the recommendation for anybody who lives in any area, whether it's on the Winnebago Reservation or not. I don't know if Mona, if you have anything to add to that.
The only thing that I would add is if you can't isolate at home for whatever reason, to please call the hotline and we can see if we can assist or coordinate, because there are housing available. Obviously, we were talking about the cabins today, and possibly some more housing options for those that are in quarantine. But there's other options elsewhere as well. So if you can just call, we can do the best we can in finding and getting you some assistance.
Thank you, Mona, and thank you, Danelle, for that answer. The next question, is the tribe going to implement a mask policy once you go outside a mask is required? I have observed that some don't wear a mask at all. Danelle or Mona, I guess either of you, if you could answer that for us.
Yes, the Winnebago Tribal Council did adopt a mask policy for the Winnebago community. So currently there is in effect a Tribal Council resolution that requires any person who goes out into a public area where social distancing of more than 6 feet is not possible. Each individual is required to wear a face covering or a mask. So that would include going into any gas station, store, the post office, any governmental building. It's also a requirement in the hospital if you're coming in for healthcare services that you are also required to wear a mask. So that is in place, and so if it's observed by the business owner or the owner of the location where it is, they can ask that person to leave.
Great, thank you for that reminder. The next question, I think it's a really good question, and we have explained this a few times, but it's always a good refresher. So the question is, what does quarantine mean? Please explain to the community again. Angie, can you help us with that?
Yeah, so quarantine is when there is someone's been identified as a close contact. They aren't actually positive with COVID infection. They've just been in contact with somebody that has been tested positive. So what we mean when we say self-quarantine is we want them to self-quarantine to their home. Before, when it wasn't so nice, most people were staying inside and just staying to their house. You can have interaction with everybody within your household, but we don't want anybody to have interaction with anybody that's not in their household. With it being nice, we have told people it is fine to go outside in their yard and to sit outside on their deck and just to be outside, because being in the sun, and that is good for everyone's health as well. So we are doing that, but everyone is being instructed that they are not to have anybody come over and play in their yard, that their kids cannot go out and play with other neighbor kids, that they have to stay just within their yard and only that area. So with quarantine, it's pretty much nobody in and nobody out of the home, but they can go out of their, go out of the house into the yard, but they can't go outside of their yard, is how it's instructed by anybody that's in quarantine.
Great, thank you for that, Angie. Next question is regarding funerals and gatherings. This is a small community and everyone knows what's going on. Are masks required to wear at funerals or gathering the entire time? Mona, can you address that?
So as Esther alluded to, there will be further guidelines that's going to be coming out next week in regards to wakes and funerals. If you contact or let us know at the Public Health Department, we can provide masks and sanitizer for the funeral. We can also provide temperature checks for the first and final viewing.
Okay, thank you for that, Mona. The next question is regards to the Senior Citizen Center closing, which I know, Mona, you announced that will be happening next week. The individual wanted to know if the seniors could get lunch with the Kids Cafe while the center is closed, just for next week anyway. Mona, can you answer that?
So as I alluded to in the beginning, if you can call the CHR program at 878-2277, we are working on an alternative plan and can get you on that list. Right now, the Kids Cafe is pretty much at max storage since they are feeding over 350 to 380 meals. They prepare 350, and anything over that, they have to do sack lunches for them. But we will be trying to find a way to get food provisions for next week for any of the seniors that may need it. So just call the CHR program and we can get you on that list to get things for next week.
Great, thank you so much for that information, Mona. The next question is, for those community members that have tested positive and are being tracked, do we know how they contracted it? For example, did they get it from work, funerals, shopping, or family gatherings? Mona and Angie, I know you guys track that, so could you answer that for us?
Yeah, the majority of our cases are from known exposures, whether that be with somebody in the household or a known exposure with a close contact that someone had an interaction with. There have been some that have been deemed community spread. So what those mean is that the source of exposure is not able to be identified. So it could be from going out and getting groceries. It could be from just going out in public and like being around somebody, but we just don't know where they were actually exposed. But a very large percentage of our cases here in Winnebago are from a known exposure.
Good, thank you for that. The last question, what help is there for enrolled members who do not live in Nebraska? Mona, can you take that one? Okay, and I do want to note that we will not be having a questions directed this week to the tribal council or tribe. So again, if you have any questions for healthcare officials, email those at covid@winnebagotribe.com. And I think that wraps up our Q&A for this week. So thank you, everybody. Garen, did you have any other comments or thoughts?
Emily or Garen, before we close out the question and answer session, I just wanted to remind people that with regard to the masks, that if there are any community members that still need cloth masks for when they go out into the public areas, to please call the CHR program and we will make sure that they get a supply of masks to use for that purpose.
Thank you, Danelle. Thank you, Emily, Mona, and Angie. Dan FEHRINGER, we do have a question that came across here. They wanted to know when the track would be open.
It's a good question. We're still debating on how we want to do that, because the last time we opened it, the social distancing wasn't practiced. But as far as, it will be open for the kids in the conditioning part in the morning. So during that time, it won't be open to community members at all. It's something we probably need to work on, because the last time there was a lot of other things going on that wasn't practicing the safe health measures. So I can't answer that at this time, but I will work on that and get an answer for next week.
Thank you. Now we are going to have closing remarks by the chairman, COLY Brown. Chairman.
Thanks, Garen. Good job, Garen. Good report, everybody. It's very informational. All your guys' comments were very touching. We're going through a lot daily, and just want the community to know that we're here, we are working, we are on site, and our health department is doing a wonderful job, and we're trying to help, and we're trying to defeat this. But any comments were made as to next week, a lot of stuff has opened up, and a lot of our people are going out. I'll probably catch heck for this, but they're going out onto the golf course, be going out onto the softball fields. If those of you that are doing this hear this, please try and be safe, keep your distance, and just try and be safe, and keep this community safe. Keep your, like I said, keep your elders safe, the children, and really think about that when you go out there. Continue the measures to try and be safe from this virus. Again, it was a really good report, and somehow I hope these reports end in a couple weeks, even this week, and we're done with this, but I don't think so. So everybody be safe, have a good weekend, and may God be with us all and bless us all. Garen, good job. Everybody else, good job. Have a good weekend.
Thank you.